High calcium intake does not cause kidney stones as many people believe. In fact, it's the opposite. A low calcium intake is associated with kidney stones, and high calcium intake protects men against them. But with one very important condition. And if you miss this one condition, you might get yourself into trouble. Here's what you need to know. My name's Dr. Tom Forfa. I reversed my osteoporosis naturally, without drugs, using my medical knowledge. This channel is for men with osteoporosis who want to reverse it naturally too. Hit the subscribe button to get our latest videos. So we're told to have a high calcium diet and even supplement with calcium when we have osteoporosis, right? So what's going on here with calcium intake and the high risk of kidney stones? Well, calcium seems to be a bit of a scapegoat, an innocent bystander, if you will, because the research shows that there are other culprits far more dangerous and proven to cause stones than calcium intake or even calcium supplementation. And as with many things in osteoporosis, the story is different for men than it is for women. So let's look at this. Kidney stones can be incredibly painful and difficult to treat. Kidney stone disease is a common condition in America, Australia, England, and other industrialized nations, and it affects up to, get this, 15% of men and 5% of women. So kidney stones are 3 times more common in men than in women. The most common kidney stones are calcium-based, either associated with oxalate or less frequently with phosphate. These types account for about 75% of all kidney stone phenotypes, whereas uric acid stones make up around 10%. So because calcium-based stones are so common, it seems to have led to this misconception that calcium intake directly causes kidney stones. In fact, it's the opposite. Contrary to popular belief, there is an inverse relationship between calcium intake and the risk of kidney stones. Multiple studies have shown that higher dietary calcium intake is associated with a reduced risk of stone formation. And you can read these studies yourself in the description below. One of my favorites is a 5-year randomized controlled clinical trial, so a fantastic trial, which found that men on a normal calcium diet, which in this study was 1,200 milligrams per day, which these days is considered a high level of calcium intake. This study found that those men on that high calcium intake diet had a 51% lower risk of developing recurrent stones compared to men on a low calcium diet of 400 milligrams per day. The most interesting part here is the mechanism by which this happens. High dietary calcium intake reduces calcium oxalate, which is the most common type of kidney stone. So this happens because of the binding of dietary oxalate and calcium in the intestines. This binding prevents the absorption of both calcium and oxalate, reducing urinary calcium oxalate supersaturation. And it's this urinary supersaturation of calcium oxalate that's the real problem here. So here's what this means. Supersaturation occurs when the concentration of calcium and oxalate exceeds the solubility limits, leading to the precipitation of crystals. Getting enough dietary calcium binds with oxalate in the gut, reducing oxalate absorption and urinary excretion. This decreases urinary calcium oxalate supersaturation, and this is a very good thing for preventing stones. There are some medical conditions that can affect these levels in a negative way, like hypercalcemia, idiopathic hypercalciuria, and chronic kidney disease. If you have any of these conditions or suspect that you do with a history of kidney stones, you should really talk to a urologist about how to best manage kidney stones. But the point is, calcium intake is not the bad guy here. Instead, Here are the real dangers hidden in the food that you eat that can cause kidney stones. Here are the 7 risk factors for kidney stones in men. Number 1 is low fluid intake. This can lead to concentrated urine, which increases the risk of stone formation. Number 2 is high sugary drink consumption, which can contribute to stone formation. Number 3 is low fruit and vegetable intake, which leads to a lack in the necessary nutrients to prevent stones. Number 4 is a high salt intake, which can increase calcium excretion in the urine, raising the risk of stones. Number 5 is being overweight, which is associated with an increased risk of kidney stones. Number 6 is low potassium intake. And number 7 is a low calcium intake. Both of those, the potassium and the calcium, are crucial for maintaining a healthy urinary tract. So with that in mind, here are the 9 ways to prevent kidney stones and still take the calcium supplements that are necessary for your bones. And this requires a multifaceted approach, especially for men with osteoporosis who rely on those calcium supplements like myself. So number 1 is hydration. This is the cornerstone of prevention. Aim for at least 2 to 2.5 liters, which is about half a gallon of water daily. High fluid intake dilutes urine, reducing the concentration of minerals that can form stones. A meta-analysis found that increased water intake decreases the risk of kidney stone reoccurrence by at least 60%. Number 2 is limit sugary drinks. You can replace sugary drinks with water, herbal teas, or diluted fruit juices. Reading labels and choosing beverages with little to no added sugars can make a significant difference. Number 3 is reduce salt intake. Limit your dietary sodium to less than 2,300 milligrams per day. High salt intake increases calcium excretion in the urine, which can lead to stone formation. You can do this by avoiding things like processed foods, fast foods, and salty snacks, and instead choose fresh, whole foods and use herbs and spices for flavor instead of salt. Number 4 is maintain a balanced calcium intake. Aim for a total calcium intake of 1,000 milligrams per day, as much as possible through food by incorporating calcium-rich foods like dairy products, leafy greens, and fortified foods into your diet. And if you're using calcium supplements, there is one important tip I'm going to give you in just a second to reduce the risk of stone formation. Make sure you stick around for that bit. It's a good one. Number 5 is to increase fruit and vegetable intake. Fruits and vegetables are high in potassium and citrate, which help prevent stone formation. Aim for at least 5 servings of fruits and vegetables daily. Include a variety of colorful options to get a broad range of nutrients, and things like smoothies, salads, and stir fries are an easy and delicious way to increase your intake. Number 6 is restrict your intake of animal proteins. Personally, I'm not a fan of this one because I like my animal proteins, but if you're using some of the others, you can probably avoid this one. But if you really want to, you can restrict intake of animal proteins, because animal proteins can increase the risk of kidney stones by lowering citrate levels and increasing calcium and uric acid excretion in the urine. And instead, what you can do is incorporate plant-based proteins like beans, lentils, and tofu into your meals. And then number 7, maintain a healthy weight. Aim for a normal body mass index. Being overweight or obese increases the risk of kidney stones due to the high levels of insulin resistance, which can increase calcium excretion. Number 8 is be mindful of high oxalate foods. Oxalates can bind with calcium in the urine to form stones, as we've mentioned a number of times already. Limit high oxalate foods like spinach, beets, nuts and chocolate, or you can pair the foods with high calcium rich foods to reduce oxalate absorption, and not miss out on your chocolate, which I personally enjoy. Number 9 is increased potassium and citrate intake. These nutrients help prevent the formation of calcium stones by binding with calcium in the urine. And you can do this by eating potassium-rich foods like bananas, oranges, potatoes, or drinking lemon water. And the last one, number 10, which is a bonus one, is to consult your doctor if you have a history of kidney stones or other conditions like idiopathic hypercalciuria or chronic kidney disease. Getting personalized medical advice is crucial for managing individual risk factors and conditions that might complicate kidney stone prevention. And if you're taking calcium supplements like I am, here is the final hack for reducing your risk of kidney stones. It's all about the timing. Here's what I mean. A study performed on men found that you should have your calcium supplements with meals rather than in between meals or at bedtime, because it works in all the ways that we've been speaking about so far to reduce your risk of kidney stones. So hit the subscribe button to receive more videos about men's osteoporosis, and I'll see you next time.